Now, it seems there might be something in the water in Queensland because for the second year running, a Queenslander has taken out the top gong at the Australian Businesswoman of the Year Awards. And yes, there's going to be an official investigation.
Anne Cross from UnitingCare Queensland was recognised for her work in the not-for-profit sector. She joins us now. Anne, good morning and congratulations.
Thank you.
Tell us what you do. Tell us about your work in Queensland.
I'm the CEO of UnitingCare Queensland, and isn't it fantastic that Queensland's won it 2 years in a row? I'm delighted.
You're entitled to say
I'm delighted, yes. UnitingCare Queensland's a very large not-for-profit. We really have 4 major divisions. It includes private hospitals, aged care services that operate from Thursday Island down to over the border into New South Wales and west to Mount Isa and Longreach and Charleville. We also have a community service division which provides services to people with disabilities and to families and children and crisis support services. And this year we started a new venture in the Northern Territory called Australian Regional and Remote Community Services, where we're operating aged care services right through the Territory.
You're the winner of the Community and Government Award, which is a really, a key one. And that area is something that's constantly under discussion when it comes to government policy and also and who's been included in the Australian conversation and who's been left out. How do organisations like yours continue to communicate the need for taking care of and paying attention to Australians who might be less well off or have perhaps slipped from attention?
Look, for me the critical thing is that you stay close to what's happening on the ground. Really you need to understand the stories of what's happening for families and children and for people with disabilities and for older people, and to be constantly talking with our staff and then of course talking with government and with the broader community about what's going on. I mean, I'm particularly there's a huge amount of industry restructure going on, which is much of it welcome, and that's all fantastic. But I'm particularly concerned when you've got those big restructures going on about what's happening to people in rural and remote areas particularly.
And we know a lot of rural and remote areas are really facing challenging times. Do you find supply of your services is struggling to keep up with demand out there?
Look, it's very difficult operating services in, up through the Cape and Thursday Island and right through communities in the Northern Territory. I mean, it's difficult to get staff. It's difficult to, to provide the quality of services that you need for people. So the demand is there, but it's actually much harder on the supply end, if you like, to actually do the response that people deserve really in those communities.
You're a very big employer. I think you've got something like 16,000 employees under all of your umbrella organisations. Do community organisations like yours, are you very different kind of employers compared to the private sector, do you think? Is there a different way of taking care of and employing people in your area?
At the core of it, of course, it's exactly the same. But we do pay a lot of attention to the culture in the organisation. And of course, if you're going to be in the business of providing services to people as a human service, then you need to really bring out the best in your staff, because that's what will deliver the service to the people. So you do pay a lot of attention, I guess, to helping staff to give their very best. Do
you have a very high staff turnover, or do you retain people for a long period of time?
It depends across different areas, really. Our turnover's really quite good in our hospitals and things. It's very low. In aged care, it's quite low in most areas. In some areas which are a bit more casualised employment, you've really got to work hard to retain people in those areas. But I mean, most of our staff love the work we do, so they're committed, and we want them to be committed.
So many inspirational and successful women in that room last night for the Telstra Awards. So what was it like being there in that
look, it's just fabulous. I mean, Telstra this is the 20th year of the awards, so what a great lot of foresight in investing in women and in their achievements. So it was just fantastic to be there. I'm just stoked, actually, that it was very inspirational to be there, and of course to win was just amazing.
And just a quick policy question before we let you go, because the news today is that the government's probably moving away from the introduction of a $7 Medicare co-payment. As someone who works in the welfare and not-for-profit sector, is that a move that you would welcome?
We were really concerned about the impact of that on low-income people, quite frankly, and of course on older people particularly. So, I mean, we have about 45,000 older people that we have contact with, and many of those that would have been really, really tough. So it's a welcome move.
And if the policy comes back in some sort of reduced form, could you live with that, or could your people live with that, do you think?
Well, you know, it's always a balancing act, isn't it, between the, you know, the reality of physical constraint and delivering the sorts of services we want in Australia. So you've always got to find that balance.
Anne Cross, congratulations and nice to meet you.
Thank you. Thanks very much.
Great to meet you, Anne.